We're now on the record. Here begins the deposition of Connie Combs. Today's date is May 7th, 2018. Time on the video monitor is 9:57 a.m. Would the court reporter please swear in the witness?
Raise your right hand, please. Do you solemnly swear affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
Yes.
Would you state your full name, please?
Connie Jane Combs.
Are you a nurse?
Yes.
Registered nurse?
Yes.
Nurse Combs, I'm taking your deposition today because I want to learn some facts that you know from your involvement in this case. Have you ever given a deposition before?
No.
All right. It's my opportunity to learn what you know. It's going to be my only opportunity to learn what you know before the trial, so it is vital that we communicate clearly. A couple of agreements before we proceed. I'd like you to answer all of my questions to the best of your knowledge and information. Will you agree to do that?
Yes.
Secondly, I'm going to rely on you to ask me to rephrase a question, otherwise I'm going to assume you understood it. That will prevent misunderstandings in front of the jury. Do you agree to do that?
Yes.
So for example, if I ask you a question, you think, he may be asking me something else and I'm not sure, just say, Mr. Kelly, would you rephrase, and be glad to do that, okay?
Yes.
All right. How long have you been employed here at Vanderbilt?
17 years.
Oh, it's a long time. Where'd you get your nursing degree?
Midlands Tech in Columbia, South Carolina.
And after you graduated from there, where'd you start working?
I worked in newborn nursery and postpartum at Lexington Medical Center in Columbia.
And how long did you work there?
I was there part-time in PRN for about a year.
What brought you to Vanderbilt?
We moved back to Tennessee.
Okay. And where do you live?
In Lebanon.
How long you lived in Lebanon?
Since moving back in '93.
Okay. Married?
Divorced.
All right. Got any family lives here in Nashville?
All of my immediate family lives in Middle Tennessee.
All right. Tell me, as of February of 2016, what your job description was.
Registered nurse on a night shift in the PACU.
And that would be the pediatric PACU?
Yes.
All right. Describe what those main duties and responsibilities are as a PACU nurse.
To recover a patient coming from surgery and then either send them home, discharge them home, or send them to the appropriate unit.
And how do you go about recovering a patient from surgery? And just give me some examples.
When we receive them from surgery, there are certain criteria that they meet before we deem them ready to transfer to the next phase of care.
Okay, now when people are going to hear your testimony, if we go try, I think I have a clue what you just said. So, because people don't work in hospitals, so can you give me an example of what you do? I mean, do you assess the patient, make sure the patient's doing fine post-operatively, call the doctor? That's what I'm trying to find out. Go ahead.
Can you rephrase more specifically?
Sure. I'm trying to understand what you do in the PACU. I have some idea, but can you give me some examples of the types of things that you do?
When the patient arrives to the PACU, you hook them up to monitors, you assess them, you review the orders.
Okay, let's break that down. You hook them up to the monitor. Is that a cardiac monitor?
Pulse ox, blood pressure, we're looking at their pulse, their oxygen saturation.
Okay.
Basically, how are they doing? You know, are they responsive as far as, you know, being awake? Are they drowsy?
All right. Do you get an order, or excuse me, do you get a report from someone in surgery about how the surgery went?
Yes.
Okay. And does that person tell you anything that you need to be looking out for after surgery?
Could you be more specific?
Sure. They say, you know, Nurse Combs, this patient's had some difficulty with high blood pressure during the surgery. Keep an eye on that. Or Nurse Combs, this patient's bleeding a little bit more than we might expect. Can you keep an eye on that? That sort of thing.
We would get that in report, but we would also request parameters.
What are parameters?
If the blood pressure is beyond a certain amount or below a certain amount, what are we watching for, and what do you need us to do about that?
Okay. Now, you also mentioned you do your own assessment. What does your assessment consist of?
Just a head-to-toe assessment of the patient. Lung sounds, pulses, responsiveness.
Okay. Tell me what, if anything, you have to do with VTE Risk Assessment and VTE prophylaxis in the PACU.
I would observe for orders, if there's orders for anything that would address that.
How would you go about observing for orders?
The post-op orders are entered in the system, and you review your orders for anything that needs to be taken care of in our setting.
Do you review those orders before you assess the patient?
No.
When do you review those orders typically?
As soon as you know that the patient has been assessed, hooked to monitors, and is stable.
Okay. And so you'll go in and you'll look in the orders to see if there's anything that pertains to VTE?
Yes.
All right.
Review all of my orders, my post-op orders.
All right. And if there's no orders pertaining to VTE, is that the end of it from your standpoint? What is it you don't understand?
I'm sorry, could you repeat?
Yes, ma'am. If there's nothing in the order pertaining to VTE, is that the end of it for you as terms of VTE risk assessment or prophylaxis?
As in what?
Well, let me give you an example. Let's say you go through the order sheet and you don't see anything in there about VTE prophylaxis. Do you do anything pertaining to that?
In order to do some things, you have to have a doctor's order. So I do not have the ability to write orders.
Fair enough. That's what I'm looking for. Is there anything else with regard to VTE you either do or are expected to do other than looking at the orders and following whatever orders are in the system?
No.
So if there's no orders in the system pertaining to putting on sequential compression devices, you're not going to put any on in the PACU, are you?
Correct.
All right.
I would need an order.
Gotcha. Do you remember in this case when Jesse came out of surgery to the PACU?
Do I remember when he came out to me?
Yes, ma'am. All right. And what do you remember?
I remember that his vital signs were stable, that he was awake and answering questions appropriately.
Okay. How do you remember that?
I just have a good memory for a lot of my patients.
That's fine. I'm just asking. What else do you remember?
I remember his mother was at the bedside fairly soon after he came back to us. I remember his younger brother was at the bedside.
Okay. Do you remember any discussions with the mother?
I just remember the younger brother, him consoling him, because it was late at night and the younger brother was cheerful. But I don't remember specific discussion with the mother, between the patient and the mother, no.
All right. What else do you remember about Jesse Wheeler coming into the PACU?
Just that he was awake and stable.
Okay. Any complications you were aware of?
No.
From what you understood from the people who you were talking to, did it appear to be a successful surgery?
We don't get as much of that information as the PACU nurse, as more as the patient's current status.
Okay. Let me see if I can put it in layman's terms. Was his current status good, in your opinion?
He was stable.
All right. And what does stable mean in layman's terms?
That we were not having to do any sort of interventions as far as like his oxygen or anything. Everything remained stable from the time he arrived to us to transferring to the next phase of care.
Vital signs and things of that nature within normal limits?
Or within the normal limits for what was expected for his situation.
All right. Now, what kind of care, if any, did you render to him? Obviously, you assessed him, you hooked him up to monitors. Anything else you can remember in terms of care that you provided to him?
Not that I remember.
All right. Do you know how long he was in the PACU?
I don't know exact, no.
Okay, can you give me an estimation?
I couldn't tell you for sure without looking at a chart.
All right. You would agree with me, when he came from the OR, he did not have sequential compression devices on, did he?
I don't remember.
Is that something you would have noted in the chart?
Yes, in the assessment.
Did you see anything in the assessment that leads you to conclude he had sequential compression devices on?
No.
If you had applied sequential compression devices, you would have made a record of it in the chart, wouldn't you?
Yes.
And you didn't do that in this case, did you?
Not that I remember. would have to have an order for it.
Do you remember Dr. Jabs coming into the PACU?
Yes.
All right. And do you know about how long it took for Dr. Jabs to come in there after Jesse came in?
To the best of my knowledge, she was on the unit waiting for him to come out of surgery.
All right. Do you remember having discussions with Dr. Jabs in the PACU about Jesse?
No.
Do you know what Dr. Jabs ordered for Jesse in terms of VTE prophylaxis?
I do not.
And I assume if she told you something about that, you don't remember. Is that correct?
Correct.
Now, when a patient leaves the PACU, where do they go from there? Oh, let me rephrase. When Jesse left the PACU, where did he go from there?
To the ICU.
And what floor is that on?
5.
Okay. Question, I think I know the answer, but why does a patient go to the 5th floor instead of the 8th floor?
Depends on orders, but it also depends on their requirements. There's a different nurse-patient ratio.
Okay. Is it customary for a patient like Jesse, who's had a kidney transplant, to go to the ICU after leaving the PACU?
Yes.
Okay. So it's nothing out of the ordinary for him to go to the ICU in this instance compared to other patients who have the same
No.
procedure. All right. Is there anything, nurse, that went on in the PACU that stands out in your mind that we haven't talked about here today?
No.
Other than you and then Dr. Jabs coming into the room, was there another nurse that came into the PACU to provide care for him?
There are 2 of us there
Okay.
anytime we have patients.
And who was the other nurse, if you recall?
I don't recall.
Did, daggum, I can't remember this lady's name. Do you remember an anesthesiologist coming in there at some point to check on him?
Anesthesia is part of the reporting team coming out of the OR. The attending usually stops by and follows up with them as well before leaving the PACU to the next phase of care.
Okay. Do you recall Dr. Hale coming in there and checking on him before he left?
I'm not familiar with that name.
All right. That'd be the surgeon.
Oh, okay. They don't always stop back by. They talk with the family. They don't always stop back by.
All right.
He's not one that I work with real frequently, so he could have been there. I just don't remember.
Now, nurse, let's assume, hypothetically, that Dr. Jabs came into the PACU and entered an order into the system that Jesse Wheeler was to have sequential compression devices applied to his legs for prophylaxis, VTE prophylaxis. And you are made aware of that order either by virtue of her telling you or by virtue of you going into the system and seeing that order. When is it customary that the sequential compression devices are applied?
If there was an order there, I would have called for the equipment and for the actual part that goes on the patient as well. So I would call Central Supply and I would call equipment and have those sent as soon as the order was placed and I was made aware.
All right. Does someone from Central Supply actually bring that equipment and the sleeves to the room?
Yes.
Do you have to sign any documentation or use your badge to reflect that inventory's been received from Central Supply?
Not on my end.
In any event, when someone brings that from Central Supply to the room, then is it your responsibility to apply the device, if you will, to the patient?
If there's an order, once the equipment's received, yes, we would apply.
All right. And do you make sure that's done before the patient leaves the PACU?
Not always, but that is reported to the nurse that you're handing off to, that they have been called for and you're waiting for them.
What would be the reasons why they wouldn't be put on the patient before he leaves the PACU?
If the patient is otherwise ready to transfer to the next level of care, we would not hold them there just waiting for those, but that would be reported off to the following nurse.
I see. So it's an issue of time frame. Perhaps if the order comes in shortly after he comes to the PACU and he's going to stay there for an hour, that might be enough time, whereas if the order's put in maybe just a few minutes or so before he leaves, you're just going to go ahead and send him on and let the next floor take care of it. I'm just trying to understand in my mind how this works.
Once the order is read and then I'm aware of it, then we would take action to get the equipment.
I'm with you there. I'm just trying to understand why it is he would leave, why it is if the order is seen and received in the PACU, why he wouldn't have those put on before he leaves the PACU. And if I'm understanding what you're saying is, if you get the order too close to the time when he's about to leave the PACU, you're not going to hold him up. You're just going to send him on to where he needs to go and let them take care of it.
Right. All orders would not necessarily be completed in the PACU.
Mm-hmm.
Once he has reached the next level of care and is ready to transfer, he would transfer. That would be reported to the following shift or the following nurse that would be assuming care.
Okay. Last question on this point. After Dr. Jabs has entered her order into the system, how long does it take for you to go into the system and see those orders?
They're there almost immediately.
So after Dr. Jabs has typed her orders in, those orders will populate into the system almost immediately?
Yes.
And then do you go into the system after she's put it in and check to see what those orders are?
Yes.
All right. Do you wait for her to finish on the computer before you go in to check for those orders?
Depends on when she submits the order. If she puts all of her orders in and submits, or if she puts a few in and submits, it depends on how she enters her orders.
But one thing we could find out is, if we were inclined to do so, is we could look at the audit trail and tell when you went into the system to find out what those orders were. Is that correct?
I don't know.
Okay. You would have to log in to find out what those orders are, wouldn't you?
It was all in the same system, so I didn't have to log out of my patient charting in order to check the orders.
Gotcha.
I could check all of that while I was logged into the
Gotcha.
computer.
Gotcha. Okay. Thank you, nurse. It's been very helpful. That's all I have.
I don't have anything, and we will read and sign.
This marks the end of the deposition. Going off the record, time on the monitor is 10:14.